A lot of you have been asking, do you take your face shield off between patients? And also, how do I keep it from popping off my loupes? And how do I clean it? Okay, so this is a very specific video topic, but I've been getting so many questions about my face shield as a dental hygienist. So today I'm answering all the questions as well as walking you through my process. Hi, my name is Whitney and I'm a registered dental hygienist here to talk about face shields. First, yes, I absolutely take my face shield off between every single patient. I mean, it's part of proper infection control. I don't wear it from patient to patient. I clean it between each patient, and also I don't want to be walking out to the waiting room and trying to talk with my patients with my shield on my face. I also don't wear my face shield during the medical history, blood pressure, or x-rays, none of the stuff where there's no splatter. I only wear it during scaling and polishing, where there's active splatter and aerosol, which is when it actually matters the most. Thinking now, I also do wear it for perio charting because I'm all geared up and ready to go when I'm doing that. Anyway, let me show you how I wear it and how I secure it as well, because this is what a lot of you have been curious about.
First of all, I'm only wearing gloves right now because I don't want to show you my unmanicured nails. Okay, so you don't have to wear gloves to do this, obviously. Now, this face shield is from Spit Blocker and I like it a lot. The only thing is for my loupes specifically, the frames are a bit wider than most loupes. So what I do to make sure the face shield stays clipped securely to the frame of my loupes is I actually remove one bumper from each side. Bumper, rubber piece, whatever you want to call it, you can see it here. So one side of the clip is exposed and then the other side has the rubber piece. Now let's do the other side of the loupes as well. There you go. Now, when I clip the face shield to my loupes, it's super secure. It's not going to pop off, right? And now I am protected from spit. It's literally called Spit Blocker. And I'm going to be taking off my gloves now, but I don't want you to see my fingers, ew.
So yeah, I wanted to insert that clip of mine so you were able to clearly see me put the shield on my loupes to properly protect me from spit, which, let's be honest, is the whole point. Like I said in that clip, that specific face shield is from the company Spit Blocker. It says it right in the name, it blocks the spit. I will link my discount code TeethTalkGirl in the description box below if you're in the market for a new shield. Next, I want to quickly explain why I choose to wear a face shield at all, because I know some people ask, do we really need it? Here's the thing. When you see what ends up on the outside of the face shield after scaling, it's eye-opening. Droplets, splatter, blood, debris, all the things that would have otherwise landed on your forehead and mask, soiling your mask, making it all wet and gross. Anyway, once you see it, it's hard to unsee it. So I prefer wearing a face shield as an added layer of protection, not just for me, but for infection control overall. It helps reduce overall exposure to saliva, blood, and aerosols, which is especially important during ultrasonic scaling with the piezo and cavitron and polishing. So that's why for me it's a no-brainer. If something is going to land somewhere, I'd much rather it land on a removable, cleanable barrier than on my face, on the skin of my forehead. Because yes, I remember my early years of being a dental assistant and wiping a cavi wipe on my forehead after an appointment. When a noticeable splatter would splash me, so yucky and so bad for my skin. I'm pretty confident you're not supposed to be using cavi wipes on skin. Obviously you're not. One last thing before we go, how I clean my face shield. So it literally says on the instructions for this Spit Blocker shield to not use disinfectant wipes, but I'm gonna be honest, sometimes when I'm in a rush, I will wipe it with a cavi wipe between patients, but I will always wipe with a wet towel and then a dry towel after as well. In my mind, it helps clean off the disinfectant solution. The reason why companies don't want you using disinfectant on their shields is because it can cause scratches over time and potentially fog up, blur up the plastic, right? You're supposed to just use soap and water to keep it clear and prolong the life of the shield. So at the end of the day, I do a good soap and water cleanse. And of course, when I'm on schedule, I'll do the full soap and water situation between patients. But when I'm running behind, I sometimes cheat and use a cavi wipe, then a wet towel. But again, you're not supposed to. I'm just being honest because everyone's asking. I've been using the same shield for about 6 months now, and it seems fine so far. It's still nice and clear and sturdy. I do work part-time clinically though, not full-time, so this is just my anecdotal experience. I don't want y'all reducing the life of your shields. I'm just sharing my story here since so many questions are popping off in the comments whenever I post any video that shows me wearing the shield. Overall, to recap, yes, I take my face shield off between every patient. I only wear it during perio charting, scaling, and polishing, not x-rays or medical history. I modified the clips on mine slightly security so it stays secure on my loupes, on my frames. And I wear it because infection control matters and spit is gross. Remember that if saliva were red video? I think about that all the time. If saliva were red, it'd be everywhere. And again, spitblocker.com. I have a discount code linked below in the description box. It's Teeth Talk Girl. This is not a sponsored video, but I do have an affiliate code with them, which is linked below. And I hope you enjoyed watching this. Please like, subscribe, and turn on your notifications if you did. And if you want even more teeth talk, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.